And whenever you're ready, you can get started.
Alrighty. Hi, everyone. My name is Dolma Tsundu, and I'm the CEO and founder of Flutter. This is my friend, Nadine. For 15 years, Nadine was a policy analyst with the Government of Canada, and she loved being able to contribute to her community as a public servant. Nadine and her husband were really excited to learn that they were expecting a baby girl, Judith. Judith was full of energy, a little kickboxer inside of Nadine's belly. But just 2 weeks before her due date, Nadine noticed Judith's movements becoming less frequent and weaker. So she went to her doctor, who took Judith's heartbeat, told her that baby's just run out of room, and sent her back home. 2 days later, little Judith's heart stopped beating, and Nadine's world changed forever. On September 18th, Nadine held her daughter for both the first and the last time. The guilt and grief she experienced after her stillbirth was debilitating. She was hospitalized for PTSD and depression, and to this day has been unable to return to work. Nadine's story is not uncommon. Every 16 seconds, a baby around the world is stillborn. And in high-income countries like Canada and the US, 30% of these deaths could be prevented. Stillbirths also put mothers at risk with a much higher chance of severe complications during their delivery. With only sporadic checkups, parents are on their own to recognize when something is wrong. In Nadine's case, she did everything right, but she had an undiagnosed maternal infection that was cutting off little Judith's oxygen. There must be a way for parents and providers to monitor health continuously from home. So, pregnancies beyond the mental and physical challenges are also very expensive. 85% of families that experience a loss will become pregnant again within 1 year. And so, if family experiences a loss and has the desire to complete their family, they're doubling the costs every time they have a pregnancy. And we know that direct costs related to stillbirths amount to $9,000, and the indirect costs amount to 97% of the costs. And this is due to the toll that grief takes on parents, such as reduced work hours and extended time off. At Flutter, we're developing a novel, non-invasive wearable device to continuously monitor maternal and fetal health from home. We've developed a new method of fetal imaging that allows us to continuously monitor fetal movements, which is one of the most established and important indicators of fetal well-being. We're focusing on the 2 million complex pregnancies each year across our first regions, the US, Canada, and the UK. But globally, there are over 130 million pregnancies each year. With a focus on this beachhead market, this represents $4 billion per year. Our technology increases compliance, decreases anxiety, and provides data that will fundamentally change how we understand stillbirth risk factors. Current technologies are really only focused on fetal heart rate, which can be misleading, whereas our technology is focusing on fetal movement, which has the power to predict distress sooner. And this is a much harder technical challenge. So unlike other technologies, our device is discreet, and we've integrated it into maternity garments, which parents are already wearing. And this helps to ensure continuous use and smooth adoption. Our technology is currently integrated into a belly band, so it is something that can be washed and is removable. But beyond this, we're also changing the way in which people experience and remember pregnancy, such as through our butterfly visualizations. So we've built defensible technologies with our patents pending. We've been able to demonstrate accurate detection, and we have safety approvals for our device so that the device can be used in clinical studies. We've been supported by key deep technology programs such as the Hardware Catalyst Initiative, where we have access to an $11 million prototyping lab for free. And we've also been backed by Techstars Industries of the Future and the National Research Council. So on October 15th, families around the world lit candles to remember their babies who were gone too soon. And we placed our device on the very first person to wear our wearable. And so we are currently conducting our first on-human studies with the goal of reaching our pivotal studies by the fourth quarter of 2025 and get to our full regulatory submissions by the second quarter of 2026. And by running this current study, it also helps to de-risk our pivotal study, which will be done in collaboration with the hospital. And we've already received interest from hospitals across both the US and Canada. And we're currently participating in the Healthy program with St. Joseph's Hospital in Hamilton. But as we await our device, we currently have a standalone kick counter app, which is available in market. And our wearable device essentially makes tracking fetal movements even easier. So this app has helped to validate the market for our wearable. So we currently have our kick counter app in market, which is an accessible tool for parents. But in 2025, we'll be releasing a premium app so that we can provide stronger analytics and visualizations. But our wearable device will be available in 2027, which will focus on helping families to understand and gain a greater awareness of their fetal movements. But our other goal is to release a fetal monitor, which would help to facilitate both the patient and provider communication. And this would integrate fetal heart rate and uterine contractions monitoring to be able to provide a continuous non-stress test. So we'll sell both B2C and B2B. For our B2C channels, we'll be looking at online and retail with private pay. That would also allow for benefit plan eligibility. So that would be both for our app and the wearable device. But we will also sell B2B, such as to hospitals and private clinics, where the device can be then rented to patients or resold. And this would allow for the potential for insurance reimbursement in the long term. So the app is at $5.99 per month as a subscription fee, and the device would be $2,000 as a unit cost and $8,000 for 5 devices. So this is to justify the cost. Continuous glucose monitor, which is a very established technology, will typically be sold between $3,500 to $6,000. And so we want this to be a high quality medical device. And we've seen that this is also a comparable within the fetal monitoring space. So to acquire our customers, we're focusing on both families as the consumer and care providers as the influencers. So we've already been accessing social media with our TikTok being able to reach over 200,000 views per video and converting to thousands of downloads. We've also been working on collaborations with advocacy groups and health KOLs. And we'll be also participating in conferences and collaborations with these organizations and providers. So this is a mix of both direct and indirect channels. So far, we've been able to build strong relationships with key health authorities, such as the Public Health Agency of Canada and the Society of Obstetricians and Gynecologists of Canada, where we're working towards a national strategy to reduce stillbirths by 30% by the year 2030. Our app has been used by over 6,800 families across over 140 countries, demonstrating global interest. And it has been promoted by organizations like the International Stillbirth Alliance and the Washington State Department of Health. But we're also proving that we are able to design for families that have experienced pregnancy loss and are becoming pregnant again. So as just one example, we have been able to successfully launch a pregnancy loss support group, which has had a considerable impact on these individuals' lives. We're not afraid to tackle difficult topics like grief and loss because we recognize this as a part of the human experience. And so this is something that has also really helped our company and our brand to stand apart. Because we've been able to develop this trust and relationships with families who have experienced these difficult experiences. So we're a technical team. My background is in integrated engineering. As a student, I was the sole national recipient of the Engineers Canada Gold Medal Student Award, but I also do bring my experience as a birth doula and have worked directly with families through pregnancy experiences. We've really focused on staying lean as a team and focused on the skills required to build our defensible technologies. So, for example, our team has led hardware development at companies like Sanctuary AI, has conducted PhD research in biomedical sensors, and have rapid mechatronics prototyping experience. And our mentors have taken medical devices to market and companies to IPOs. So for example, Liz Monroe was the former co-founder of Perimeter Medical Imaging, which went public, as well as Brent James, who also took a company public and was the former CEO of Row Mobility. We're also receiving technical and product mentorship through individuals like Jack Pryor, who was an early engineer and senior manager at Dexcom, which is one of the largest continuous glucose monitoring companies, and was also acquired by Medtronic. We've also been receiving clinical mentorship from physician leaders like Dr. William Fraser, who is the former Canada Research Chair in Maternal and Fetal Medicine, and Dr. Niraj Mistry, who is a neonatologist at Toronto Sick Kids. So we're raising $2 million to get through our clinical trials And we'll be also using this funds to get to our FDA submissions. And we've already seen within the space that companies are able to go public. So both Owlet and Nouveau have gone public and are in the wearable space. And we've also seen major acquisitions from companies like Samsung within the fetal monitoring space. So little Judith's legacy does live on, and we believe that there is hope. As an example, Nadine and I worked together to successfully advocate for new national fetal health surveillance guidelines. So now in Canada, every family after 26 weeks should be advised to regularly monitor fetal movements. And if they notice any reduction, then they should seek medical attention right away. So we've moved away from this oversimplified guideline of 6 movements in 2 hours, but are now encouraging families to understand their unique baseline. And so this is what our technology is essentially helping them to do. And in doing so, we're also elevating the standard of care for perinatal health globally. And the fact that we've already helped to change national guidelines is just evidence that we're doing this even before our device has hit market. And so to us, pregnancy is a reminder of what a miracle it is to be human. And so from the very first letters in your belly to the first time that you're holding your baby, we want every family to have a positive experience. Thank you.
Thank you, Dolma. It's a very moving presentation. I'm going to ask Julia just to confirm the ask before we get into the Q&A.
Thank you, Dolma, and I agree. Totally amazing story that you have there. I understand that your ask, you said 2 million, and is that Canadian, your ask, or?
It's in US dollars.
Everything's in US dollars. Okay, so $2 million US, and you're proposing a $11 million post-money US dollar safe with a 20% discount and a most favored nation clause, correct?
Yes, that's correct.
And you've got signed safes based on that already?
No, so this would be a new round that we would be opening.
Okay.
So our safes are from our earlier round, I guess.
Earlier experience. Yeah. Okay. Yeah. Okay. Thanks.
Okay, great. Questions for Dolma? Victoria.
Yeah. So yeah, thanks for the great presentation. And yeah, it's a sort of tragedies, but here I just want to connect dots here. So based on the Nadine's story in your case, then how this product could change that story, because it looks like she went to the doctor, she monitored it, and then still tragedy happened. So can you connect that dots for me?
Yeah, for sure. It's a really good question. So in Nadine's case, she actually was not aware of monitoring fetal movements at all during her pregnancy. It was just her intuition that was telling her that something was wrong. And so that's why now she's like a really big advocate for tracking your fetal movements. So if she had been aware of that earlier, it would have allowed her to be more cognizant of her fetal movements and potentially go and seek out that medical attention earlier. And also, one of the things that we're trying to highlight with our technology is that it has the ability to change how we understand stillbirth and how fetal movements connect to that as an indicator. So one of the challenges for us is also being able to educate care providers that it is really important, and there's a lot of myths that continue to be perpetuated. And so now the SOGC, the Society of Obstetricians and Gynecologists of Canada, have changed their guidelines to make it so that every family should be advised to regularly monitor fetal movements. And so that's a part of the piece as well, is being able to educate those care providers. And we are working with the leadership of these organizations to make sure that that message is sent to all care providers across Canada.
So maybe just a quick follow-up on then the consumer business. You had a free app, and then so it sounds like you don't have any plan on monitoring that, right? So maybe would you like to share some data
Sure.
on?
Yeah, let me just go back here. So we do actually have a plan to monetize it. So right now we've kept it free, and it's allowed us to build these relationships and validate the market. But our goal is for next year to launch a premium version of that so that we can begin to monetize that app before we get into the wearable device as a unit cost.
Do you have that in the forecast? Like numbers, financial numbers?
Yes, so that's something that we have been adding to our financials. So in our financials, we've broken down the app and then also the wearable device.
Okay, can we move on? We got a lot of questions here lined up, so we can come back perhaps to confirm some of that later, Victoria, if need be. Jennifer?
Yeah, and great presentation. And we talked a little bit about this when I watched one of your practice pitches, but can you speak a little bit as you look at the global market and longer term, how you might get that cost down from 2000? Because a lot of stillbirths are in poorer communities with less access to this kind of device.
Yes, absolutely. So we've decided to focus first on like high income countries. So the $2,000 is a cost that is comparable to medical devices that you'll see in this type of like use case. So when it comes to lower income countries, like that is definitely a part of our mission, is to be able to help prevent stillbirths around the world. But I think we need to start somewhere first. So there could be different models, for example, if we are able to get like government support in terms of subsidizing some of these costs, or if it's a model where, you know, if someone purchases this device, then it also allows for a family in a different part of the world to be able to access it. So I think there's a lot that we could work with. But this cost here, we're trying to also account for like the B2C marketing that will be involved and distribution. So
yeah, I was really thinking over time, like as you get higher volumes, do you see that price being able to come down?
Oh, yeah, I think with with mass manufacturing, like that could definitely come down. But yeah, we wanted to start it here for now.
All right, Kebby.
Awesome, lovely to meet you. Great presentation today. Can you maybe talk to us a little bit? So I wrote down that you were going through direct, so social media events, you can think like direct to consumer and indirect methods. Can you talk about your go-to-market strategy as to why you're not going directly through healthcare providers that are specific to women's health? Would be my first. It's kind of a twofold question. So OBGYNs, women's health clinic, etc. And then secondly, are you able to collect and aggregate the data that you're getting from these devices? So of course, in the short term, it's personalized insights and recommendations, but is there a longer term play perhaps into like population health insights or predictive analytics, or perhaps even clinical decision support? So thinking like that data could be used for preventative measures.
Yes, absolutely. So I guess to answer your second question, that is part of the vision, is to be able to use this data to inform like public health policy and understanding of stillbirths. So you can see here in the roadmap that that is like the final stage for this device, is for the providers to also be able to access this data. But it will just take time for us to accumulate that first and to be able to draw those insights from it. And then for your first question, so we believe that there's less barrier to entry if we start with consumers. We know that there is a real desire for this type of technology among families. But what we're trying to do is actually have healthcare provider influence in these purchase decisions. So it's not like we're working separately, but even though the consumer is the main user of this device, and that's like where the value is being driven, we want the healthcare providers to still be able to trust this device and to be able to recommend it to people. But then in the longer term, and we've also included it here, we want to have like a B2B channel where the device is sold to hospitals and not also, or clinics, and gives that advantage to the clinic so that they can say, hey, we have this device that we can offer to you as a part of your care support at this institution. So it's definitely working together. It's just a matter of like staging.
Okay, we've got about 30 seconds, so I'm going to ask the last quick question from the chat. Is the device patented?
Yes. So we have submitted our patents. So it's a systems and methods patent, and it covers the sensor technology itself, and then also how we're processing the data.
All right, great. Thanks, Dolma. Thanks for the wonderful presentation.
Alrighty, thank you so much.
All right, take care.
Well done.